Let's go through what an assisted birth is. An assisted birth refers to the use of medical instruments or procedures to help deliver your baby during the final stage of labour when you are pushing. This is typically done if your labour is not progressing as expected, or your baby or you are showing signs of distress. There are two main types of assisted birth: a forceps assisted birth and a vacuum assisted birth. A forceps assisted birth is when forceps, which are metal tongue-like instruments, are gently placed around your baby's head. Your healthcare provider then uses them to guide your baby out of the birth canal while you push. Forceps are often used when your baby is in a good position but needs extra help moving through the birth canal. A vacuum assisted birth is when a ventouse, which is a soft or hard plastic cup, is placed on your baby's head and gentle suction is applied to help guide your baby out as you push. The suction creates a vacuum that helps pull your baby during contractions. A vacuum delivery is typically used when your baby is close to being born and you need help with the final pushes. So why might you need to have an assisted birth? The first reason is if your labour isn't progressing. If the second stage of labour, or the pushing stage where you give birth to your baby, is taking too long, or your contractions weaken, an assisted birth may be necessary. The next reason might be that you are exhausted and too tired to push effectively after a long labour and you need some assistance. Another reason might be that your baby may be experiencing fetal distress, for example, an irregular heart rate, and needs to be delivered quickly. So in cases like this, an assisted delivery might be recommended. As well, medical conditions like high blood pressure, heart disease, or certain infections may limit how much you can safely push, necessitating assistance. And finally, the position of your baby may result in an assisted birth. So if your baby is in a slightly awkward position, but not enough to require a C-section, forceps or vacuum might be used to help your baby be born. Let's go through the pros and cons of an assisted birth, starting with the pros. So firstly, assisted births may prevent the need for a caesarean section, allowing you to have a vaginal delivery and a shorter recovery time. An assisted delivery can help speed up delivery if your baby needs to be born urgently, especially in cases of fetal distress. It also helps you if you are fatigued. So if you are too tired to push effectively, assistance can help get your baby out safely. Let's go through the cons now of an assisted birth. The first is you might be injured. So forceps or vacuum use can increase the risk of vaginal or perineal tears. In some cases, an episiotomy, which is a surgical cut, may be performed to widen your vaginal opening. Next, your baby might be injured. So although rare, the use of forceps or vacuum can sometimes cause temporary bruising, swelling, or marks on your baby's head, which usually heal without any long-lasting effects. In rare cases, more serious injuries like nerve damage can occur. There is also a higher risk of infection, so an assisted delivery can slightly increase the risk of infection for both you and your baby. You won't have an assisted delivery though if your baby is in a breech position or too large to pass safely through your birth canal. As well, if you have certain health conditions, a C-section may be the safer option rather than an assisted vaginal birth. So an assisted birth can be an important intervention that ensures both you and your baby stay safe if your labour isn't progressing as expected. While it has some risks, the benefits often outweigh those if it helps you avoid a caesarean section or prevents prolonged distress during delivery.